High blood pressure does not cause problems over a day or weeks or months. High blood pressure causes problems over many years, and it can affect your entire body. Let's talk about some of the body's structures that are most affected by high blood pressure. These include your blood vessels, heart, brain, kidneys, and eyes. The small blood vessels in the vital organs are most affected over time. These vessels become scarred, hardened, and less elastic, which means that they are more likely to get blocked or rupture. This may happen as you get older, whether or not your blood pressure is too high. But high blood pressure can speed up this process. Another way that high blood pressure affects your blood vessels is that it may play a role in the development of atherosclerosis. A person has atherosclerosis if their arteries thicken because of fat and cholesterol buildup on the artery walls. High blood pressure adds strain to the blood vessel walls, which puts them in more danger of getting atherosclerosis than they would otherwise be. If the inside of your blood vessels gets smaller and harder, and the pressure inside them goes up, then your heart has to pump harder to get blood through them. Your heart is a muscle, and just like other muscles, working this hard makes your heart get bigger. This is not a good thing for your heart. It can get stretched out, and some of the blood that is supposed to pump through your body stays back in the heart. Eventually, your heart begins to weaken because it simply cannot continue to pump so hard against the pressure in your vessels. When the heart can no longer pump out all of the blood that enters its chambers, this is a serious condition called congestive heart failure. A symptom of this condition can be fluid that backs up into the lungs and chest cavity. High blood pressure can also damage the brain. Blood vessels in the brain can get blocked or rupture, just like blood vessels anywhere else in the body. The difference is that if it happens in the brain, there may be bleeding there, or the brain tissues won't get nutrients and oxygen from the blood. High blood pressure is a major cause of strokes and bleeding in the brain. It can also affect normal brain function as a person ages. The kidneys are also important organs that can be damaged by high blood pressure. If the arteries that supply blood to the kidneys are damaged, then the kidneys' tissues will not get the blood they need, and the kidneys themselves can gradually lose their ability to function. High blood pressure can cause changes in the retinas of your eyes. The retina is where the eye receives visual images. The blood vessels in the eyes are also at risk of getting more narrow, rupturing, and bleeding. These changes can cause impaired vision and, over time, may lead to blindness. As you can see, blood vessels, the heart, brain, kidneys, and eyes are the structures in your body most affected by high blood pressure. That's why a person that has had high blood pressure for many years is at a serious risk of heart attack, stroke, and kidney failure. In fact, if you have high blood pressure and it is left untreated, you are 3 times more likely to have heart disease, 6 times more likely to develop congestive heart failure, and 7 times more likely to have a stroke. Fortunately, a person can make lifestyle changes that will help lessen the strain on their heart and blood vessels. This helps to control the bad effects high blood pressure can have on the organs.
High blood pressure ranks as the #1 risk factor for death and disability in the world. Previously, I showed how a plant-based diet may prevent high blood pressure, but what if you already have it? The American Heart Association, American College of Cardiology, and the Centers for Disease Control and Prevention recommend as the first-line treatment lifestyle modification. If that doesn't work, you can start the patient on a thiazide diuretic or water pill, and then you keep piling on the meds until you get their blood pressure down. Commonly, people end up on 3 drugs, though researchers are experimenting with 4 at a time, and some people end up on 5. Why not just jump straight to the drugs? Well, they don't treat the underlying cause, and they can cause side effects. Less than half of patients stick with even the first-line drugs, perhaps due to the adverse effects such as erectile dysfunction, fatigue, and muscle cramps. So What are these recommended lifestyle changes? They recommend to control one's weight, salt, and alcohol intake, engage in regular exercise, and adopt a DASH eating plan. The DASH diet has been described as a lacto-vegetarian diet, but it's not. It emphasizes fruits and vegetables and low-fat dairy, but just a reduction in meat. Why not vegetarian? We've known for decades that food of animal origin is highly significantly associated with blood pressure. In fact, if you take vegetarians and you give them meat, you can watch their blood pressures go right up. I've talked about how there are benefits to getting blood pressure down as low as 110/70, but who can get that low? Populations eating plant-based diets, like in rural China, about 110/70 their whole lives, with meats only eaten special occasions, or rural Africa, where the elderly have perfect blood pressure as opposed to hypertension. In the Western world, as the American Heart Association has pointed out, the only folks really getting down that low were the strict vegetarians, coming out at about 110/65. So when they created the DASH diet, were they just not aware of this landmark research done by Harvard's Frank Sachs? No, they were aware. The chair of the design committee that came up with the DASH diet was Dr. Sachs. In fact, the DASH diet was explicitly designed with the #1 goal of capturing the blood pressure-lowering benefits of a vegetarian diet, yet contain enough animal products to make it palatable to the general public. In fact, Sachs found that the more dairy the lacto-vegetarians ate, the higher their blood pressures. But they had to make the diet acceptable. Research has since shown that it's the added plant foods, not the changes in oil, sweets, or dairy, that appears to be the critical component, so why not eat plant-based? Recent meta-analysis showed vegetarian diets were good, but strictly plant-based diets may be better. Vegetarian diets in general confer protection against cardiovascular disease, some cancers, and death, but completely plant-based diets seem to offer additional protection for obesity, hypertension, type 2 diabetes, and heart disease mortality. Based on a study of 89,000 people, those eating meat-free diets appeared to cut their risk of high blood pressure 55%, but those eating meat-free, egg-free, and dairy-free had 75% lower risk. If, however, you're already eating a whole food plant-based diet, no processed foods, no table salt, and you're still not hitting 110/70, there are a few foods recently found to offer additional protection. Ground flax seeds, a few tablespoons a day, induce one of the most potent antihypertensive effects ever achieved by a dietary intervention, 2 to 3 times more powerful than instituting an aerobic endurance exercise program. Watermelon also appears to have extraordinary effects, but you'd have to eat like 2 pounds a day. Sounds like my kind of medicine, but it's hard to get year-round. Red wine may help, but only if the alcohol has been taken out. Raw vegetables or cooked? And the answer is both, though raw may work better. Beans, split peas, chickpeas, and lentils may help a little. Kiwi fruits, though, don't seem to work at all, even though the study was funded by a kiwi fruit company. Maybe they should have taken direction from the California Raisin Marketing Board, who came out with this study showing raisins can reduce blood pressure, but only, apparently, compared to fudge cookies, Cheez-Its, and Chips Ahoy.
There are 3 main kinds of blood vessels: arteries, capillaries, and veins. Arteries are large blood vessels that carry blood from your heart to the rest of your body. This blood is rich in oxygen and nutrients. As arteries get farther away from the heart, they begin to branch and become smaller and smaller. The smallest branches are called capillaries. And this is where the oxygen in your blood is transferred to your tissues. In exchange, the wastes from your cells, including carbon dioxide, are transferred into the blood. Just beyond this area, the capillaries begin to merge together and eventually form larger vessels called veins, which lead back to the heart. As the vessels carry deoxygenated blood back to the heart, waste products are routed to other organs, where they are removed for disposal. As the deoxygenated blood makes its way back through the heart and lungs, it picks up oxygen and nutrients. The heart then pumps the blood out through the arteries, and the cycle is repeated.